Okay, let's get started at 6 p.m. Pacific Standard. You guys might be in different time zones, but Pacific Standard Time. Let me double check to make sure it's streaming in Facebook because one time I had a problem. So just give me 1 second. Yep, great. Woohoo. Okay. Okay, so I took a poll and everybody wanted insulin resistance, or no, there was most common insulin resistance. So we're going to do that this time. So I'm going to go through these kind of slides about my open office hours that I do every week. So every Tuesday at 6 p.m. Pacific Standard Time, I do open office hours. So the first 30 minutes is a webinar format. And then the last 30 minutes, and sometimes it's over that, and that's okay. Then those that are in my membership, who are in my practice, can go over to the Zoom link that you get in the membership. And it's open office hours. So you can ask me questions, you can talk about whatever we were talking about in this presentation, or you can just chat with each other. It's happened too, either way. So the first 30 minutes is a webinar, and then the next 30 minutes or so is for my members only in my practice. If I have a guest on, which I did, Elise Harlow, who was the nutritionist that's in my practice, if I have a guest on, we usually take that entire hour. So we don't do the open office hours for members because I want her to be able, or him or her, to be able to answer questions. So any of the time I'm doing open office hours, if you guys have questions, you can actually, StreamYard lets you just click in and add the question, and it'll pop up on my stream over here on the right, and I'll be able to tell if someone has a question specifically. So I can always answer them as I'm going through. So remember, these are really just open office hours, open for the public. Whoever wants to join the Facebook group can be a part of it. If you're in my membership or in the practice, then you can actually be part of the Q&A session after this. I do this because I really want people to understand what integrative medicine is. I want it to be accessible to everyone. So if you just want to take the information that I'm speak about, like for instance, the holistic approach to anxiety, and you want to use it on yourself to change the way that you think about how to treat anxiety, that's fine. That's what this is about, is access to information, access to what integrative medicine is. And then my ideal healthcare model is really a combination of healthcare visits that you with your doctor, chiropractor, acupuncturist, whoever is part of your healthcare team, community to support each other and help each other, and ongoing learning about what is the latest and greatest that's helping people with their particular illness. So I wanted to start it off with the talk today about insulin resistance, because a lot of times in my practice, I get asked, why am I doing everything? Why am I working out so much? Why am I doing everything I'm supposed to be doing, but yet it's not working? I'm not getting the results I want. I'm not losing weight, or I'm not reversing my PCOS, or I still have menopause hot flashes and I'm upset. And a lot of times I think, unfortunately, doctors, we tend to sort of tell patients, well, it must be something that you're not doing. You're not working hard enough. You're not doing what you need to do. You're not following through. And it's really not, that's not true. And I really hate when patients tell that to me, that they were told it's because they didn't work hard enough. It's not your fault. It's really your hormones. So much of what drives, especially, menopause and PCOS symptoms and anxiety, all of this is related to your hormones. So once you learn how to optimize your hormones or figure out what is the cause, then oftentimes you can reverse those symptoms and not be miserable. It's really not you. It's not your lack of willpower. This is really biology. My slide for the E. So insulin resistance. So I liked this definition from the Cleveland Clinic. It's a complex condition where your body just does not respond to insulin. Insulin is the hormone that's secreted from the pancreas that tells the cells that, in many cells, muscle cells, liver cells, multiple cells in the body, that you need to take the glucose or the sugar in, and really glucose is the better term, in the blood system, and bring it into those cells so that they can be used as energy, that blood sugar, that glucose can be used as energy. Well, when you have insulin resistance, so this top, I liked this graph and I borrowed this from, and you can see I'm giving credit at the top to the person who created it. What happens is, you eat food, it's broken down in the gut, that sugar or glucose is in your blood system, and the pancreas should respond by releasing insulin that says, okay, I had this amount of sugar, I need to release this, I need to release insulin to be able to to absorb and to take that glucose out of the blood system and move it into cells to be used for energy. So that's what should normally happen, is these cells, different types of cells, will use that glucose and convert it to energy. Well, when someone has insulin resistance, it's kind of like knocking at the door all the time, right? So you have high blood sugar. Your pancreas is doing its best to secrete insulin and just keep giving more and keep giving more, but it's just too much in the blood system, too much in your circulation. So your body says, well, I need to store some of this as fat. I need to store some of it in my liver, in glycogen stores. And unfortunately, when you have constant high sugars, there's no break in between. The pancreas is always releasing insulin. And by doing that, it's like constantly being knocked out of the door. Like if someone just, I sort of think of this as like your kids, when your kids are like asking for something in the back of the car, right? Can we have a snack? 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 And eventually you just basically stop. You just ignore them, right? You're like, I can't do it anymore. No more. I'm not even listening to you. And that's kind of what happens, is it's the cells no longer ignore they sort of start ignoring the signal that says, bring this glucose and bring it into the cell to be used as energy. So then you have a ton of extra glucose in the blood. And again, it has to be stored as fat. So this constant high blood sugar leads to insulin not being able to tell the cell to take that glucose or that sugar into itself to convert to energy. And so the pancreas says, okay, well, there's high sugar in the blood. I'll just keep releasing more. So I'll just keep releasing more because there's more and more sugar. And this causes this vicious cycle that happens where people, eventually the pancreas becomes just not as responsive. It can't keep up and ultimately cannot secrete enough insulin to combat the amount of sugar in your blood system. And then you ultimately end up with diabetes. So what causes insulin resistance? So there's so many, it's not just about, eating too many carbs, eating too much sugar. Now that's a big component, right? If you eat too much sugar, if you have highly processed foods and high fructose corn syrup, then of course, excess sugar will cause this insulin resistance. But there's also other factors. People who are sedentary, people who are obese, people who don't get sleep. Believe it or not, your risk of insulin resistance and ultimately diabetes is drastically increased if you sleep less than 7 hours at night. Chronic inflammation causes insulin resistance. So even someone who has, say, adrenal fatigue, can chronically be inflamed and lead to insulin resistance. This is also common in women with autoimmune issues like hypothyroidism. So if they have sort of this chronic inflammation from their autoimmune issue, they can certainly lead to insulin resistance. And we'll talk a little bit about that link in a minute. And obviously, I didn't say this at the end, but genetic susceptibility, right? Most of these things we think certain people are susceptible to insulin resistance or diabetes. So you have family history, you're susceptible to it, and then you add these other components on and they turn those genes on, and ultimately you end up with that disease. That's actually what nutrigenomics is so cool for. That's something that I offer with my patients, is 3x4 genetic testing. It's actually looking at your genes and saying, okay, this is what you're predisposed to, say diabetes or thyroid or cancer. And what we want to do is take that information to not turn on the genes, to eat certain foods, to take certain supplements, to only use certain medications, to not turn those genes on. So nutrigenomics is a new field that's really, I think it's quite fascinating. So much of what we do in medicine in the future will be about what we know about someone's genes and what to treat them with, basically. So what happens when you have insulin resistance? Well, this is what happens frequently with women who have insulin resistance, like say PCOS, or they're having chronic inflammation, hypothyroid symptoms, and still having issues, and certainly in people who are pre-diabetic. So if you have high insulin all the time, you're having, high glucose in the blood, right? They kind of go hand in hand. Well, there's a hormone in your fat cells called leptin. Leptin is supposed to tell your brain, like, let's just stop eating. We don't need to eat anymore. We're full. We have enough glucose hanging around. Well, it also develops this sort of resistance. So you don't get this signal that actually there's enough glucose in your blood that you don't need to eat anymore. So you get cravings for more sugar. Your body actually literally thinks it's starving, even though it's not. And so it's this vicious cycle where you get cravings. And of course, when you have a craving, it's going to be for a high sugar content food because our body says it's time, we need glucose now, immediate, like, any immediate sugar source. So it's going to pick the high sugar food. It's not going to pick the carrot. And so this is this cycle that constantly happens where people have cravings, even though they really have enough glucose in their blood, they have cravings for high sugary content food, sweetened beverages, things like that. Then they get even more glucose in their blood, even more leptin resistance. And leptin obviously is in fat cells, so you store that extra sugar in your fat as well, which leads to more cravings. So this constant cycle that sometimes is very difficult to break. This is why women find weight gain to be very difficult when they have PCOS because of this constant cycle that happens. I brought this up because this is also, and it's maybe a little complicated, but I can simplify it. Essentially, when you have insulin resistance, this high insulin interferes with the pulsatility of what should happen in the part of the brain that tells your ovaries, the hypothalamus, that tells your ovaries what to do. So there's a part of the brain that secretes FSH and LH that say to your ovaries what to do, like to make estrogen, to make progesterone. So when you have high insulin, it interferes with the pulsatility of that part of your brain. So you're not actually making the signal is not correct to tell your ovaries what to do. And so often women who have high insulin or insulin resistance or ultimately diabetes end up having a ton of problems with their periods. They end up having hormonal issues on top of their insulin resistance. This is also part of the PCOS picture, but you could be perimenopausal and have some insulin resistance issues. And then you find out your estrogen levels high and your progesterone levels low. So, and it also causes a problem with growth hormone and ultimately inflammation. And all of these sort of are related to this insulin and how the insulin feeds back to the part of the brain that tells those hormones not only how to be produced, but when to be produced. So how can you test for insulin resistance? Well, if you went to the primary care doctor, they often will do a hemoglobin A1C, which is a very normal test. It actually reflects your glucose level over the last 3 months. It's a great test. It should be less than 5.7. If you have diabetes, it should be less than 7. But the other way that you can really test for insulin resistance, because hemoglobin A1C can be normal, but you could still be sort of pre-diabetic. So a fasting insulin level and a fasting glucose level are really effective to sort of look at the ratio to find out where you are on that spectrum of insulin resistance. You can also do an oral glucose tolerance test where you take a set amount of sugar, and then they test your blood at fasting, and then they test your blood an hour and 2 hours afterwards to try to determine how you're metabolizing that sugar. Well, all of these tests can be run in a standard primary care doctor's office. OB/GYN, conventional medicine has capability of doing all of these tests. But you should make sure that you're getting tested for these, because oftentimes I see patients who've gotten hemoglobin A1C and, it's fine. It just doesn't really tell you what level of insulin resistance someone can have. So how do we break this cycle? What are some steps to help sort of break insulin? If you find out that you have insulin resistance, then what can you do? So I'm going to go through kind of these steps. So obviously the first one is eliminating processed sugars. So processed sugars, there are a lot of processed sugars that I don't like to tell the patients just to eliminate sugar, because there are many forms of sugar. It's unrealistic in my mind just to say don't eat sugar. People like sugar. I like sugar. It's really about trying to focus on what types of sugars are you consuming and how can you balance that with the other things that you're doing. And one of the reasons to sort of look at processed sugars or, white cane sugar is because processed sugar usually causes an immediate absorption into your blood system. So it's that quick action that I told you when you have cravings. Typically you want something fast. It's going to increase your blood sugar. So it can also cause this sort of dysfunction of you not realizing you're actually full. And so you eat more sugar, like if you've ever had a donut and then like 30 minutes later, you're kind of like, well, all right, what's next? People often pair sort of coffee with creamer and all the sugar in their coffee. And then they have a donut, which is just adding to the same problem where you're essentially getting this quick hit of sugar and then you're hungry in an hour. it didn't do anything to keep you full. It's also associated with high visceral fat. Visceral fat there's two types of fat: the sub-Q fat, which is what you kind of see in the mirror when you're may or may not be happy with the way you look in a certain outfit. And the visceral fat is the actual internal fat that surrounds your organs. Well, visceral fat is the stuff that's long-term associated with high blood pressure, high cholesterol, diabetes, heart attack, stroke. So it actually associated with that higher visceral fat, which I mentioned a couple of presentations ago about the difference between brown fat, white fat, and beige fat. There's also been a lot of association of processed sugars with wrinkles and aging effects. So if like I said, it's not about just sort of eliminating all sugar, because there are different types of sugar. So I always tell people, step one, the easiest thing you can do is go into your pantry and look for high fructose corn syrup. High fructose corn syrup is in a ton of products, a ton of stuff. Believe it or not, you'll go through your pantry and go, really? Darn, because it is everywhere. And that is the worst type of processed sugar that you can be eating, because it's really quick absorption of the blood system, really causes leptin resistance, causes a lot of problems with hunger and cravings. And overall, you sort of get this dysfunction in your brain health where it thinks it's never full. Like you have disruption between the ability of your body to distinguish between when it's really full and when it's not. And so this is kind of a cool graphic that sort of describes the changes that happen when people have sort of these processed sugars. They get leptin resistance, which leads to higher amount of sub-Q fat, which is kind of what you see in the mirror, and higher amounts of visceral fat. And overall, visceral fat will also increase your cortisol levels, the stress hormone, and increase inflammation. So it causes not only problems with what you sort of see as what people think of weight gain, but also the internal visceral fat, which ultimately leads to higher cortisol issues, inflammation, and then what's next? Our hormones get all kind of wacky. So if you could do anything with processed sugars, don't eat anything that has high fructose corn syrup. That's like the takeaway lesson from that particular thing. Step 2, exercise daily. So this is actually, a lot of people don't realize this, but muscle actually burns glucose at rest and also in motion. Muscle has cells that are independent of insulin, meaning that they don't actually need insulin to get glucose into them to use as energy. So if you're exercising daily, you'll actually burn extra glucose in your blood system without even needing insulin. So I don't know if you know this or not, but oftentimes diabetics are told to exercise every single day, exercise right after they eat, because it does improve their blood glucose levels pretty quickly from right after eating. It not only does that, but also it's great for mood and easing stress. And building muscle mass overall will help you, again, if that muscle burns calories at rest, or burns glucose, at rest, then ultimately you're going to end up burning more. Your metabolism will be higher. This is especially important in women over age 40. We lose so much muscle mass from age alone. So building your muscle mass, very, very, very important when you're over 40. So muscle burns glucose at rest, like I mentioned, and in motion. It's not dependent on insulin. So one thing you can do is literally walk after you eat. So eat dinner, go for a 30-minute walk. I always kind of get hesitant to say what types of exercise, because the one thing I think it's really important is that people need to do what they enjoy. If you run and you hate running, then you're going to increase your stress hormones, you're going to increase your cortisol, increase your inflammation, and you're going to hate it and stop it. So I really am a big proponent of doing things that you enjoy. Walking, swimming, Pilates, lifting your grandkids, whatever it is. I mean, there's so many things you can do. Walking in place. I had one patient who just loved to walk in place. She was a truck driver and she would stop at her stops and she liked walking in place for 30 minutes. That's what you like to do. It works. So it's really about what you enjoy, but to do it daily. Just so you know, the recommendation is 150 minutes per week, divided however you want, or 90 minutes of intense exercise. Step 3, find your macros. This is so much is new on the forefront about finding your macros. And what I mean by what carbs, what protein, and what fat work for you. There's a metabolic, there's the calories in, calories out model does not work. There's a metabolic sweet spot for every single person. There is literally, once you sort of figure out what your metabolic sweet spot is, you don't gain weight. You don't typically gain weight unless you obviously go out and eat a bunch of food that you weren't supposed to. But when you stay in that metabolic sweet spot, you typically maintain weight. So you need to find the metabolic sweet spot. And you also have better nutrient absorption because your intestines are not inflamed. You're not having issues with inflammation. So when you eat food, it's absorbing into your blood system. I'm going to mention what no naked carbs is in just a second. So no naked carbs. So I took this presentation. I really wanted to make it very simple steps, because it can be very complicated when we're talking about insulin resistance and where to go. But I wanted to take some very simple steps. So one thing you can do for finding your macros is you can literally, when you're sitting down, and I'm not telling you how many carbs or protein or fat to eat. In general, people recommend about 40% carbs. Oh, actually, I think I have that on the next. In general, 40% carbs, 30% fat, 20% protein, building sort of a balanced plate, essentially. But some people have a metabolic sweet spot that's different. I've had patients who they function better on a higher fat content and lower carbs, or higher carbs and less protein. You have to figure out what is the ratio that works for you. And you can do that by just trialing it, figuring out what works, how you feel. Are you having, and the way you know this, right, is if you sort of aim for 40% carbs and you realize you're having shaking episodes or you're hungry between meals, you're going to have to adjust it based upon the symptoms that you're having. Are you fatigued? Are you bottoming out before the end of the day? Are you, these things are things you're going to have to document. So you can literally write down and focus on a certain amount of what your macros are going to be. And then you can journal and write down what's happening with symptoms related to those and sort of figure out your sweet spot. Or continuous glucose monitors are fantastic. Now they actually are inexpensive. They used to be very, very expensive. Now they're like $99 for a month, which is very reasonable considering the technology that you're getting. They actually monitor real-time data to tell you what your blood sugars are. So you can say, okay, I pretty much eat this for breakfast every single day. What does this mean for my blood sugars? So I found so much good data from me when I did them to try to figure out, how do I respond to sweet potatoes? How do I do with black beans? How do I, just to understand what combos work better for not spiking my blood sugar. It saves time. It saves the guesswork. I think now that it's affordable for most people, that it's great to do it. This used to be hundreds and thousands of dollars, probably 2 years ago. And now it's much, much, much more affordable. And so I've used this with patients who really wanted to dial down on what they can eat without having to spend, 6 months to 8 months figuring it out. I'm going to pull back up this naked carb slide, because one rule of thumb, if you did not want to do the macro count and you didn't want to do continuous blood glucose, what you can do is just, if you have carbs, don't have them alone. You want your carbohydrates to slowly absorb. You can follow sort of that glycemic index to figure out which types of carbs to eat by all means, but in just a very basic form, make sure your carbs are paired with fat and protein. They will help absorb those carbohydrates better. So if you want to have a waffle, it's okay to have a waffle, but make sure you have peanut butter on top of it. Make sure that you pair it with, if you have some protein, sometimes people put chia seeds or flax seeds on top of the waffle so that they can get fiber and also some healthy fat and protein with there. So there's ways to sort of still eat the foods you want and enjoy, but making sure that you're not having this immediate blood sugar spike, because most people will have a waffle, put syrup, put butter, and add, a ton of sugary fruit on top of it, the fruit, you know what I mean, the frozen fruit stuff. And then their blood sugar just hugely, it goes through the roof. So making sure you pair carbs with fat. So this is kind of the basic step. Then you get into sort of more advanced things like finding your macro count, and then continuous blood glucose monitors. Step 4, intermittent fasting. So intermittent fasting, this is, and I'm going to do a presentation all on intermittent fasting because there's so much we could talk about related to the basics of it, but also specific populations that benefit from intermittent fasting, like women over 40, women with hypothyroid, PCOS. Like there are some data to support certain populations that it's really effective for. So intermittent fasting can really is associated with weight loss, definitely improves your mitochondrial function or your energy, and will improve your blood glucose levels. And really, there are I think the two big benefits are improving the way that your body uses fuel, so burning fatty acids as well as glucose, and then also increasing your energy. Those are really two big benefits of intermittent fasting. Supplements. So I'm going to mention a few supplements. This is by no means the whole list. There's a ton of them that we could talk about. And really, supplementation to me is always second. Food is always first. Supplementation can often kickstart blood sugars. So if you're someone who's really struggling with getting your blood sugars under control, then supplementation can help start that while you're working on sort of the dietary changes. So medications, I want to mention the standard medication for blood sugar balance is metformin. It's an insulin response enhancer, so it helps your body, it improves your insulin sensitivity. The pro is it does lower your blood sugar very effectively. It is inexpensive. It's very widely prescribed. The con is that it does cause GI side effects. That's the most common reason people stop it. And it also can deplete vitamin B12 and magnesium. So if you're on it long term, you're certainly going to have some GI issues. Interestingly enough, which I thought this was so cool, that there was a 2002 study that's actually published that looked at lifestyle compared to metformin. And believe it or not, lifestyle changes, those are the things I was just talking about, had a 58% reduction in developing diabetes long-term over a 4-year time frame, and compared to 38% in metformin. So lifestyle changes are actually more effective than metformin. Berberine is a chemical found in plants like European barberry and golden seal Oregon grape. I know someone in the group had mentioned berberine for PCOS. This is a very common supplement used for PCOS. It also is beneficial to lower blood pressure and cholesterol. It's used for sort of that metabolic syndrome. Certainly effective in women who have sort of a component of several things going on. There's also some good effects on the gut microbiome to help replenish the good bacteria that need to be back into the gut. So it's great for classical PCOS or type 1 PCOS, where you typically have a very high metabolic syndrome picture and gut issues. There's not a lot of studies on berberine, but you know, a lot of these supplements don't get studied because, frankly, there's not a lot of money behind it, right? There's not a lot of pharmaceutical companies put up the money for a lot of studies nowadays. And there's just not going to be an herb company that's going to put up that sort of money. So I look at sort of the pros and the cons. What are the concerns? What are the side effects? What am I using it for? And so the only thing you have to do is be careful with any meds that are being metabolized by the liver using the CYP450 system. So not a lot of these. These are mostly like some hypertensive drugs, obviously diabetes drugs you have to be cautious with, right? Because if this lowers blood sugars, you don't really want to have 2 diabetes drugs. So you do have to be careful from that standpoint. But it is a very good supplement and very effective. Inositol. Inositol is a simple carbohydrate, which is in both animal and plant tissues. We actually have myo and chiro inositol in our bodies. It lowers blood sugars by decreasing insulin resistance and very good for metabolic syndrome as well as PCOS. And there is some good data on Alzheimer's and reducing plaque formation, which I find very cool. Very good for mood and anxiety. I use this sometimes for anxiety issues, not related to metabolic syndrome. So again, not a lot of studies because, again, these supplements are not going to be readily, there's not going to be a lot of randomized controlled trials. The only person that has to be a little careful is people with bipolar, but they have to be very careful with a lot of supplements. Cinnamon and green tea are antioxidants. So I was telling you that the sort of interplay between inflammation, so decreasing inflammation so it doesn't cause any damage to your DNA and ultimately keep turning on these genes. Some really good antioxidants are cinnamon and green tea. I often stick cinnamon in my coffee. Just why not? Tastes good, and also it's good for you. Dandelion also, there's a lot of good data with dandelion tea, which is also very effective for antioxidants. So in summary, really, like, here's some basic steps to sort of start looking at insulin resistance. First, you need to be tested. Like always, I always say test, 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 see where you are. But if you cut out high fructose corn syrup, that's step one. Cut out seed oils, which are like canola, vegetable oil. Those often have a lot of, trans fat and saturated fats. Balance your plate, no naked carbs. So try to have carbs paired with protein and fat. Intermittent fasting is a great way to sort of kickstart some insulin to reduce your insulin resistance, but also good for weight loss if that's your goal as well. And certainly good for people do use it for brain health, for improving memory, for focus, for clarity. Very common in athletes to sort of boost their performance. And then using supplements if needed to kickstart your blood sugar control. So I always put this at the end because I think it's important to understand what integrative medicine is. It's really about taking a good history. I do a 60-minute visit with patients. All my visits are 60 minutes because I really want to dive into what we can do. Testing for those things that could be abnormal, like we need to test. We don't want to guess, we want to test. And we add nutrition, lifestyle, stress management, sleep management, supplements, herbs. We all add that to the bigger whole picture of how to treat someone as opposed to just treating their symptom. They have anxiety, here's an SSRI. That's not what we do in integrative medicine. We want to know what the cause is of their anxiety. And then we add these components to try to address the bigger picture. So that's the end of this one. So if you are a member in my practice, then you're going to pop on over to the Zoom link that you got on the welcome letter or you've gotten through the email. And so we'll chat over there if you have any questions. And then next week is, what did we talk about next? Oh, intermittent fasting. And then we have postmenopausal symptoms. All right. Have a wonderful night.